Okay, so our topic was medication errors. I'm Emily Bondanza.
I'm Sherry Gebline.
I'm Timothy Greco.
And I'm Ariel Russell.
Okay, so our clinical problem is that medication errors are causes of significant problems. They can range from simple errors to life-threatening complications. Some of the common errors include the 5 rights, so wrong dose, wrong route, wrong drug, wrong patient, wrong time. The main problem we're trying to eliminate is what causes these errors. And currently, we have a Pyxis, the RN double checks, the Omnicell, and the EMAR to try to help us with that. So why change our current practice? Because medication errors cause harm to our patients. Longer stays, they can cause drug interactions, under and over medicating the patients, and if it's not changed, we'll continue to cause harm to our patients. So our proposed evidence-based practice change is the use of medication vests. While the nurse is passing meds, she must wear the vest. Patients, staff, and family members are warned about what wearing the vest means, and as you can see in the picture, there's a little sign on her vest saying "Do not disturb." And they are all made aware that while the nurse is wearing the medication vest, they are not allowed to speak to her or him. To measure the change, we will see the amount of medication errors before and after the implementation of the vest over a 6-month period.
Synthesis Study 1, Medication Errors in Home Care, a qualitative study. The purpose. The purpose of this study was to explore nurses' experience with medication errors in home care. Findings. This study found that incomplete exchange of information between healthcare workers, out-of-date information, and lack of reporting of medication errors lead to medication errors in the home health care setting. Relevance. This is relevant to nursing practice because better communication between nurses, doctors, and pharmacists is needed to prevent medication errors. Current research. Current research says that focus on research is being transferred to home care setting from institutions. Home care is organized differently than institutions, and there is often errors when patients are transferred from institutions to home care. The study's strengths. The study's strengths come from having a sample size of 20 nurses, which is a large sample size for a qualitative study. The study used content analysis to analyze the study. Study weaknesses. This study was comprised of a focus group of nurses from a small town in Norway. Only registered nurses in home care were involved in the study. Further areas to study. Further areas to study include using several sites and including hospital and nursing home nurses for generalizability. Benefits and risks of the project. There are no real risks to this project. This project can help illuminate what nurses think are the causes of medication errors.
Synthesis Study number 2. The purpose of this study was done to prove how the nursing workload compromises patient safety and is directly correlated to medication errors. Dosing errors were the most frequent type of error, directly related to the number of staff. This is relevant to nursing practice because units are commonly understaffed and it jeopardizes patient safety. The strength of this study was that it used descriptive statistics. The weakness of the study is that it was performed only at one site in Brazil due to short timing of execution and had a small sample size of only 49 nurses. Current research and further areas to study include staff to patient ratios and decreasing the workload in order to focus on passing medications.
Synthesis number 3, this was about the safety vests. The purpose is to see if the vest improved the medication error outcomes. The findings, current evidence shows positive outcomes for the safety vest after discovering that distractions were one of the main problems. The relevance, work interruptions create danger at the bedside, particularly during med administration. This was just a chart from my study, and it broke down all the distractions that nurses reported as being sources of error. So that would be the physician coming up, a phone ringing, another patient, visitors, all things that I'm sure we've all experienced. Current research says that distractions during MedPass were the most common errors reported. which is shown in that chart that I just showed. The strengths of the study, it wasn't very costly, and it's pretty easy to implement on a floor. The weaknesses would be it's a small sample size. It was only used at one floor at one hospital. Further areas to study could be in different settings like long-term care, and the benefits of this and risks of this project. There's no real risks involved, but the benefits were the improved patient outcomes that it found.
Synthesis study for impacts of pharmacists. The study focused on the medication discrepancies that occur when patients are discharged. The study highlights the needs for pharmacists to be involved in the medication management and reconciliation for patients. The results of the study showed that approximately 2 out of 5 patients had a discrepancy in at least one of their medications prescribed to them. The results of this study proved that with adding pharmacists to help review medication orders, then the number of medication errors would be reduced. The relevance: medication errors are constantly happening during the process of medication administration. Adding pharmacists into the process to help review medication orders helps reduce the number of medication errors. However, this still isn't enough to completely prevent medication errors. Strengths and weaknesses: pharmacist students were used to help to keep costs down, and there was a small sample size. Further areas to study: having pharmacists participate in not only the discharge process, but when patients are first admitted. Current research: use of pharmacists in reviewing medication orders to decrease the errors with medications. And benefits and risks: the reduction in medication errors, and there really is no risk.
Synthesis study number 5. The purpose of this study was to implement a custom alert on the computerized prescriber order entry to prevent medication timing errors. The percentage of medication errors decreased by 50% with this custom alert. And this study is relevant to nursing practice because it prevents medication timing errors and alerts nurses if there is a dose too close. Further areas to examine: on a greater scale of patients to get more accurate results. The benefits and risks of the study. The benefits: the study brought a new idea about how to avoid giving the medication again. And the risk is if the computers crashed, or they're out of use, nurses could not rely on this method. Some of the strengths and weaknesses. A strength is that medication errors were significantly decreased by 50%, and a weakness was that the portion of charts reviewed was small compared to the number of patients receiving the medication. The design. Our plan would be to have nurses wear the MedVest on different units for a year instead of 6 months. In order to implement this change, we will do pre- and post surveys, direct observation, and documentation of medication error statistics. We will make MedVest available prior to the change. The outcome measure that will be tracked is the number of medication errors during the time frame where the nurses wore the MedVest.
Implement and evaluate. Where? We would do this on medical surgical units in hospitals. The stakeholders would be the hospitals, patients, researchers, nurses. Benefits: there would be a reduction in medication errors. There would be no risk involved. For measuring progress, we would take the number of adverse events for medications prior to the start of the study compared to the number of adverse events for medication errors during the study. This change would be adopted in the hospital setting.
Integrate and maintain. Nurses will be informed that they will be wearing their medication vests for longer by their nurse manager. There also will be emails sent and signage posted. In the healthcare setting, we would implement medication vest usage by all nurses who dispense medications every shift in the hospital. Monitoring of process change. We would integrate wearing medication vests into the standards of practice in the hospital. The wearing of medication vests would be integrated into hospital protocol. In-service on how to wear the medication vests and their use would be held. Online competencies for medication vest usage will be provided.